Welcome to Thursday's edition of COVID-19. Our daily tally today remains little change from yesterday as we mark a year since the World Health Organization declared COVID-19 a pandemic. And we touch upon our efforts against the virus thus far later on in the program. Before that, though, we also shed light on the alarming unrest in Myanmar. But first, here is the broader pandemic coverage with our Hyunsuwa. So do start us off then.
Well, Sunny, as you said, not a big change to Korea's COVID-19 tally this Thursday. 5 fewer cases than yesterday, meaning 465 infections. And that includes 444 domestic transmissions and 21 imported cases. And that raises the total to 94,198, and the death toll stands at 1,652. Now, for 3 straight days, we see that the numbers have been lingering in the 400s, and we haven't been seeing a clear sign of improvement for many weeks now. So while the government may unveil the final version of a new social distancing scheme as early as Friday, the nation might have to remain under the current social distancing measures, which are currently at level 2 in the metropolitan region and at level 1.5 elsewhere, as almost the entire nation is seeing at least 1 case every day and still triple digits in Seoul and Gyeonggi-do province. Now, on to the vaccination front. Now, seniors who are among the most vulnerable against coronavirus infections, but were excluded from receiving the first shots of AstraZeneca vaccines due to lack of data, are now expected to receive their shots soon. Here's why.
Following in-depth discussions by a panel of experts yesterday, the government decided to expand AstraZeneca vaccinations to people aged 65 and above. Now our task is to speed up our vaccination rollout.
Now, the total number of inoculations has surpassed 500,000, which means almost 1% of the entire nation, with some 51,000 vaccinations conducted yesterday.
I see. Meanwhile, on the international front, so I understand the UK variant has been found to be quite deadly.
Right, Sunny. According to the British Medical Journal, that is, the B117 UK strain is 30 to 100% more deadly than previous strains. And this is quite alarming, especially because it's widely known that the UK variant is already spreading at a much faster rate than other strains of the virus. And due to variant concerns, now there are resurgences in many countries, especially in Poland here, with some 17,200 infections in the past day. That's the highest daily figure since November. And also resurgences here in France and Italy with over 30,000 and 22,000 infections respectively. And Brazil now has more daily cases than the US. And also the fatalities there are growing, with some 2,286 deaths reported on Wednesday alone. And the total number of infections around the world stands at 118.6 million. And another surge in daily cases, with over 470,000 infections reported in the past 24 hours. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
All right, so thank you for now. Meanwhile, on the international front, the pandemic continues to be a painful plight for many across the globe. But for some, the fight has been especially brutal as they're forced to seek protection against rampant violence as well. A military coup in Myanmar and a bloody crackdown on protesters there are making global headlines. And for more on this conflict, I connect now to an individual in the region whose identity we have chosen not to share amid safety concerns. Hello there.
Hello.
Can you hear me?
Yeah, I can hear you.
Right. Now, people, I understand, have been taking to the streets across Myanmar since the military took power at the start of last month. There have been reports of appalling brutality against the public by armed forces. Could you tell us a bit more, please?
Well, since the country is under the military dictatorship, people decided to fight against the junta till the end of, till the end. And with different ages, not just the young people, but also, like the elder generation as well. But of course, mainly we are seeing the Generation Z, they're at the front line, they're fighting against, the junta. At the same time, we have the CDM, so this obedient movement going on in the country. Many people are supporting the CDM, which they believe that, that's going to be a big threat for the junta. At the same time, as we have seen the report that many casualties and injuries are being reported, across the country. So, which means that the military is not, is not really giving the favor to its own people. At the same time, people are they don't really care what is the response from the military and the security forces. They will keep fighting till the end.
I see. I hear the military there has also sought to suppress media opposition to the military coup. What can you tell us about this alarming event?
Well, the thing is, they are trying to remove and abolish. They're trying to kill all the media. It's like they're trying the media industry in Myanmar. So I would say at more than 30 the journalists being detained, arrested, and charged since the coup. Not only the local journalists, but also the foreign press, the foreign journalists are being targeted. So some of my friends, they are not granted the visa. The visa are not really extended. It's like the military is trying to control. They're trying to kick off all the independent media from the country. At the same time, as we have seen, they raised up the media houses. They raised up the journalist house, and of course now we only have two TV stations, which are owned and controlled by the military. And many people believe that these TV stations are broadcasting all the fake news and the propaganda.
I see. That is quite shocking. Now, prior to the attack against the press, I believe security forces had earlier threatened medical workers and facilities. How is the police presence at hospitals affecting the treatment of patients in general?
Well, as I mentioned, that the CDM movement is going strong, and the CDM movement was initiated by the medical workers and the railway workers. So, most of the medical workers in the country joined the CDF movement. The hospitals are closed. So it's like kind of a threat from the military to the medical workers, at the same time, they are trying to, the station, and they're trying to send their troops to the hospital, across the country. So, which is a really threat for the medical workers, who are joining the CDM.
Right. What about the wounded people during the protests? Do they have a place to go for treatment?
Well, they have, because these CDM medical workers, they are volunteering, for the medical cover. So they are everywhere. But they're not at the hospital, but they're everywhere. They have place, to give the treatment. They are frontline. If there's anything happening, they can go there and they can give the treatment. So I don't think that's the issue. But of course, at the same time, some public hospitals are open. If there's any serious injuries, or if they need any operation. So even though the many medical workers join the CDM, but I don't think there's the gap for the treatment and the medical services, because as I said, many workers are willing to invest their time as a medical free medical cover.
I see. Well, that is reassuring to know. Now, before you go, is there a message that you would like to share with our audiences across the world regarding Myanmar's plight and its people?
Well, the thing is, it's very clear that the Myanmar people do not like the junta, and they're not happy living under the junta. And also, I've been talking to different people. They cannot really sleep. They have to go to their own neighborhood at night. And they have to defend from those night arrests and the raid. At the same time, daytime, they are now out on the street and, protest against the junta. Now I'm speaking to you, from one of the protest area. So I'm seeing, a lot of young people are out, they're trying to, prepare themselves in the self-defense with the sheen and the stuff. So, which means that, people are really, really upset with this junta. So, this is my message that, from what I can see and what I can tell.
I see. All right, and do stay safe, and thank you very much for making the time to shed light on these very sad and shocking events in Myanmar.
Thanks so much for having me. Yeah, bye. Cheers.
Right, we are back here in Korea with the local briefing on the COVID-19 situation. We'll come back to you afterwards.
And among them, we have 82 confirmed cases, and also 363 more people have been discharged, while 7,871 people still remain in quarantine. And we had 4 more people with critical or severe conditions, raising the total to 127. We had 4 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And here are some major updates on our domestic cases by region. First of all, overall in the metropolitan area, we have about 75% of the total cases today. And in Gyeonggi-do Province, Gimpo City, in relation to a factory there, we also have 11 cases. And also in Gyeonggi-do Province, Arirang City, we have a total of 107 cases breaking out at the livestock wholesale market. And in Dongducheon City, in relation to the foreigners cluster, we are carrying out massive testing and epidemiological investigations. And in Chungcheongbuk-do Province, Jincheon City, in relation to a meat processing company, we have over 4 dozen cases. And also in relation to a university, we also have 36 cases being confirmed to date. And in Gyeongnam Province, in Ulsan City, in relation to the public bath at Bukgu District, we identified 15 additional cases, raising the total to 40. And in Gangwon-do Province, in relation to an accommodation facility in Pyeongchang-gun County, we have a total of 22 being confirmed to date. And next, in relation to the new variants, here are some updates. The quarantine authorities are noting that here in South Korea, we are eyeing the genetic sequencing testings here on the samples, and we have expanded this. And up until now, we have carried out some 3,700 samples so far, and about 70% that is are domestic cases, and 38% are imported cases. And as for domestic cases, after May, we have seen 90% were G8 strain. And as for the imported cases, we have seen a G8 strain standing at about 38%, which is the highest. We also saw GRY, and so forth. And among them, GRY strain is the what has been described as the WHO as the UK new variant. And after October, that is up until now, we have seen a total of 182 new variants, and the GRY, which is the UK variant, we have 154 cases, and 21 South African new variants. And also, as for these 3 new variants, aside from them, we are also witnessing in many other countries, we are still seeing an increase in the number of reported cases. However, we do not also have clinical data as for the fatality or so forth, and we have seen such new variants being identified here in South Korea as well. First of all, U.S. California variant. After December of last year, we have seen 68 cases here in South Korea, and the U.S. New York variant, and also the UK and Nigeria variant. Starting from February, we have seen 3 and 4 respectively, and in total, these other new variants account for about 75 cases here in South Korea. And such 75, we have 30 imported cases and 45 domestic cases. And as for the sources of infections, we see the 30 imported cases, 19 of them have been identified at the points of entry, while 11 have been identified while they were on self-quarantine. And also, as for these domestic cases, these 45 domestic cases, and we have seen all of them were Korean nationals. 43 people were related to the 11 cluster infections, and 2 were individual infections. And all of them were also identified while we were eyeing on the monitoring of the new variants here in South Korea. And to this end, the government is trying its best to contain the influx of further new variants to Korea. And we are also working especially with the local governments. And we have a special team at each of the local governments to intensify their monitoring for these self-isolations who have been traveling to South Korea. And we are also intensifying our quarantine for foreign community clusters as well. And we are also producing a pan-government campaign as well. And moreover, we also have some exemptions of these quarantine. And we see that these people could be susceptible for the COVID-19 new variants. And they include the people who work in the airline industries. And we have included about 20,000 of them in the eligible recipients of the vaccinations here in South Korea for the second half of this year. And to this end, as you know, the South Korean government is exerting its full efforts to contain the further spread of the virus, and especially the new variant. And moreover, it is very important that all of the foreign entrants, as well as their immediate family members, comply stringently with the quarantine measures while they are on self-quarantine. Next, in relation to the live quarantine measures, we have the safety e-report, and we have some reports of the breaches of quarantine measures. And we also would like to introduce to you some breaches at the public transportation. As for the drivers of buses and taxis, we have seen that there were reports of not complying to the face mask mandatory rule, and also they consumed food as well. And also at ferries, they also did not wear face masks while they were on these ferries. And also, we have seen that people engaged in group tours with more than 5 people, and also they were purchasing tickets with a group of more than 5 people. And please note that this public transportation is used by random people, and we believe that it could also have overcrowdedness, meaning that it is very susceptible to COVID-19 infections. So we ask for your compliance to these quarantine measures. And next, we have some R&D as for our the COVID-19, and as for the remdesivir, we have administered the drug to a total of 4,975, and the Regulora treatment has been administered to a total of more than 380 people here in South Korea at over 47 hospitals. And as for the blood plasma treatment, we also have been using them for 41 cases here in South Korea for treatment, and we have seen that 6,600 people have been admitted, extending their blood plasma donation intentions, and we have been using their samples to develop such therapies. And also, we have been securing their blood plasma samples. And after the COVID-19 infections, we are seeing for how long it takes one person to develop the neutralizing antibodies. And we also have been carrying out intensified research on about 117 people who are the members of Shincheonji, and we see that after 3 months, the development of the neutralizing antibodies stood at about 78. And also, we have seen that this lingered for the next 6 months. However, it dropped slightly. However, we have also found that the neutralizing antibodies also persisted. And we see that the level of the natural development of the immunity will be very helpful for our further development of our vaccines. And we will also be looking at the neutralizing antibodies that are developed after a vaccination, and we will be comparing these two and utilizing them for further research. And we also had the research experts panel on mRNA vaccines and the vaccine development on Tuesday. And we also have a new group of experts being established by the experts of the mRNA vaccines, and we are also providing support for the drug makers and developers, and we have been discussing the government's roadmap for further support. And as for the vaccination roadmap, we also have seen that there are clinical trials that will be needed, and as for these target groups, we are also seeing the timeline of the WHO as well as the timeline of other foreign pharmaceutical companies that have developed the COVID-19 vaccines. We are looking at their similar timelines as well. And to this end, we are also devising a roadmap that entails the details for developing an mRNA vaccine here in South Korea. We will be disclosing them as soon as they are ready. And as for the vaccination recipients, we are also going to carry out the antibody testings on a regular basis, and we will be looking at the data and as for how much people develop their antibodies after receiving their jabs. And as for the inoculation of the COVID-19 vaccines, as of March 11th midnight, we have a total of 51,100 more people being administered with their first dose, with the total standing at 500,635, and our target rate stands about 64% of the total target group, and we also have a total of 6,859 cases of reported adverse responses after the inoculations, and among them, majority of them were common and mild symptoms, and 57 had also suspected cases of anaphylaxis, 5 cases of convulsion, and a total of 15 cases of death have been reported, and we are under investigations, and we will be disclosing the details in a transparent manner to the public. And as for the AstraZeneca vaccines, we also have a further arrival plans. And starting from last week, May, we will be also getting some vaccine doses for about 3.5 million people for these AstraZeneca vaccines. And we believe that the first round of the vaccines, which is about 1.7 million people, this is the second consignment shipment that we will be receiving from last week of May until first week of June. And we also had some vaccine accidents where we had to discard our vaccines and were not able to utilize these vaccine doses. And we see that 770 vaccine doses for across 7 hospitals have been ordered to be discarded. And to this end, we are cooperating with the government-related government ministries, and we will also be monitoring and intensify our monitoring for the handling of these vaccines to make sure that these mistakes will not be repeated in the near future as well. We will also ask the hospitals to take particular precautions when they have the storing and the handling of the vaccines. And yesterday, we also had the experts panel who recommended that the AstraZeneca vaccines can also be administered to senior citizens over the age of 65. And according to research carried out at UK and Scotland, they have analyzed these results on the senior citizens, and we have seen that those above the age of 65 could also be eligible for the AstraZeneca vaccines. And to this end, starting from March, we will also look at the residents and workers at nursing hospitals and also the care fair facilities, and they above the age of 65, that is, they will be also being administered with the AstraZeneca drug, the vaccine, within this month. And we also see clinical trials showing that if there is a greater time of interval between the first and second dose of the AstraZeneca vaccines, we will be also, to this end, we will be increasing the interval from 8 to 10 weeks. And as for the research, we have enclosed the details details, so please refer to your press kit. And last but not least, a 1 year ago, the WHO has declared a pandemic of the COVID-19 infections. And even to this end, right now, at this very moment, we believe that many Korean citizens are complying well with the face mask rules and also the individual sanitization matters as well. And to this end, we were able to also contain the virus to this extent. And as a quarantine official, we also want to extend my deepest appreciation to you all. Nevertheless, despite the public's participation and persistence, we also see continued lingering of the COVID-19 infections, and we do not see a clear decline of the infections. And what's more, we are seeing a slight increase of the reproductive index. So please let me go over the aim of the quarantine measures by the quarantine authorities. We aim to also contain the further spread of the COVID-19 and to minimize our fatalities. And also this is the same for our vaccination rule as well. And as for the aim, our purpose, and the timeline of inoculation, we believe that by September, we believe that we will also reach an immunity among the senior citizens, which are more prone to have higher fatality rates. And despite the fact that we will also be continuing with the vaccinations for people under the age of 65, we believe that we will also have a greater confidence in fighting over the COVID-19. Of course, we still have many variables. First is the fact that we need to contain and minimize our daily tally, and also we need to minimize our reproductive rate as well. And also it is very important that we also have a full-fledged vaccinations, and the speed should be consistent going forward. And also we need to contain the influx of new variants. We also need to see whether the vaccines can also protect people from the new variants as well. So we believe that starting from this moment up until September will be a very crucial moment in our fight against COVID-19. So in order for us to overcome the COVID-19 pandemic and also minimize our daily tally, we will also carry out massive testing and epidemiological investigations as well as tracing. We will look if we have any loopholes in our quarantine measures. We will exert our full efforts. Thank you very much.
Right, that was Kwon Junuk with us, his afternoon briefing. He spoke quite at length about variant cases here in the local, Francois.
Right, apart from the 182 variants from the UK, South Africa, and Brazil that we talked about before, the government now has said that there are 75 cases since December, including 68 variants from the US, California, and also a few from New York and from Nigeria. And given the dangers of the variants from abroad, 20,000 flight attendants will be included in the group of people to get vaccinated in the second quarter of the year, as they are exempt from self-isolation. And quick update on the vaccination front. Seniors are expected to achieve herd immunity in September, and also the AstraZeneca vaccine, which has been now approved for seniors aged 65 and above, is expected to be starting this month.
I see. All right, so as always, thank you for that. I'll see you tomorrow.
See you tomorrow.
Right, now as mentioned earlier, it's been precisely a year since the World Health Organization declared COVID-19 a pandemic. And in this next report, we meet with a few of the selfless individuals who partook in our early battle against the virus and its challenges. Do take a look.
People from all walks of life have been doing their part to aid Korea's year-long struggle with the COVID-19 pandemic. In January 2020, a woman who had flown in from China became the first reported case of COVID-19 on Korean soil. At the time, doctors still had very little knowledge about the new coronavirus that was emerging from Wuhan.
당시만 해도 우한시에서 나오는 정보가 거의 그것밖에 없었습니다. 논문도 아주 초기적인 단계에 그런 정보밖에 없어서 정말 막막했던 것 같습니다. 그래서 그 전에 이제 메르스 비슷한 코로나 바이러스니까 메르스 때 썼던 약들을 뒤져서 그 중에 이제 가능할 만한 약을 투여하고 1년 지난 지금 현재 시점에서는 정말 눈부시게 빠른 속도로 잘 대응해왔다고 생각을 하고요.
The patient from China made a full recovery and left a thank you note to the medical staff after being discharged from the hospital. The doctor who treated Korea's first COVID-19 patient took note of his experiences and came up with the idea of drive-through screening centers.
기존의 방식대로는 검사 물량이 따라가지를 못하니까요. 이제 환기가 제일 잘 되는 공간 그리고 가장 프라이빗한 공간을 찾다 보니까 그렇게 고안이 됐던 것 같고 이제 검사뿐만 아니라 드라이브스루로 뭐 백신 접종까지 이제 하고 있더라고요. 그래서 응용돼서 더 잘 쓰이고 있어서 저도 뿌듯하고 좋습니다.
Drive-through screening centers have put Korea in the global limelight as an innovator in the fight against COVID-19. Elsewhere, sign language interpreters have played a crucial role in helping those with hearing disabilities stay informed on the latest government announcements.
진단 키트라는 것이 처음 나왔을 때 제가 본 적이 없기 때문에 수어로 구현하는 데 있어서 상당히 좀 애를 먹었던 기억이 나고요. 정례 브리핑이라는 곳에 수어 통역이 거의 2분할 사이즈로 된 거는 이제 한국에서도 처음이기 때문에 특히나 이게 재난 브리핑이다 보니까 제가 혹시라도 실수를 하거나 하면 정보가 잘못 전달되기 때문에 더 노력을 하고 있습니다.
Sign language interpreters have now become a permanent fixture in the Korean government's daily briefings on COVID-19. The city of Daegu was at the center of Korea's first wave of COVID-19 infections in early 2020, with around 6,000 cases and more than 100 deaths being reported in less than 2 months. Volunteers nationwide flocked to Daegu to help the beleaguered city. This volunteer worker cannot forget the heartbreak suffered by the family of COVID-19 victims who passed away, unable to be at their side in their final journey to the afterlife.
사람은 그 자식이 외국에 한 5, 6년 가까이 있었던 모양이에요. 그랬는데 펜션을 시작하고 왔는데 돌아가신 거야. 그래서 그분을 갖다가 고인을 한번 보여달라고 그러는데 보여드릴 수가 없잖아. 왜냐하면은 방역 수칙에 의해서 그게 안 되니까 그게 참 가슴 아프더라고. 야, 참.
Despite the start of Korea's vaccination campaign, this is no time to let our guards down. Many doctors on the front line say our response to COVID-19 must continue to evolve.
감염병이라는 건 늘상 있는 일이 아니기 때문에 평소에 준비를 해야 되거든요. 제2의 코로나19는 계속 올 거거든요. 그리고 좀 더 그 크기와 모양을 달리해서 올 거기 때문에 공공의료를 강화시키는 정책을 추진하고 이런 것들이 반드시 이루어져야 될 걸로 그렇게 생각합니다.
People from all walks of life must do their part to mount a collective response to COVID-19 and end the pandemic once and for all.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
And if the vaccines begin to impact not only on death and not only on hospitalization, but have a significant impact on transmission dynamics and transmission risk, then I believe we will accelerate towards controlling this pandemic.
In today's session, we look back at the past 1 year of efforts to counter the pandemic, as well as assess our current status amid the rollout of vaccines and explore the prospects ahead. I have Dr. Yu Byung-wook from Suncheon University Hospital. Pleasure to have you back, Dr. Yu. And I also have Professor Son Ho-jun from Johns Hopkins University joining this session virtually. Good to see you again, Professor Son.
Hi, Sunny. Pleasure is mine.
Right, Dr. Yu, what is your assessment of the global fight against the pandemic over the past year?
Well, for all countries, we having the very new virus. From the beginning, we under chaos because we don't know exactly how to respond it. But fortunately or unfortunately, Korea, we had an experience was 2015 with the MERS coronavirus. After that, we are preparing kind of fundamental measure against some virus. So that's why we can respond a bit properly than other countries. But from now on, I believe that we are all going together, and we are response and the fight against can be happen to other variants of the COVID-19 or other new virus. We have to do the fight against it together. But I so appreciate it for Korean peoples who follow the Korean government guideline. And finally, we are standing here. We're still among the wins of the COVID-19, but I believe we will go from this the big wins soon.
Right, hopefully in the near future. Professor Soon, despite the rollout of vaccines, there are concerns of a fourth wave across the globe in the near future. Do you share this grim forecast?
Yeah, so we certainly have many reasons to be concerned about this new rise, largely a couple of reasons. First of all is we're seeing rise of the proportion of different new variants, especially UK, South Africa, and Brazil, and so on. And then we know that the biological properties of these variants that can potentially impact the higher levels of transmission and disease severity is confirmed. And also, while we don't really have an epidemiological evidence of their impact, but we're seeing in the U.S. and other countries they're prematurely easing restrictions, and people are taking light of the social distancing practices in midst of all of the vaccination efforts that's going on. And I think this can really impair our overall efforts to curb this pandemic. And then we know with the vaccination, it takes time for people to be protected from vaccination. And then at the same time, vaccination coverages are not so ideal to see any of the herd effects of these vaccinations. And then also on top of these, we know that there are so many operational, social, and behavioral issues with vaccinating and implementing these public health measures to cope with the pandemic. So aside from these concerns, though, I think we have many positive signs resulting from all of the previous efforts, including vaccination, social distancing, and personal hygiene practices, and the government restriction policies in response to the new variants. And we are seeing sharp declines in new COVID cases for the last several weeks. So this is something that we need to be proud of and thinking positive about going forward. And then, and this is also important, our experiences about these measures and how we've coped with this is a great lesson and that can be continued in the next subsequent waves of the pandemic. So we should continue to be vigilant when we're in a high-risk situations, practice our social distancing policies, wear our masks, and do the personal hygiene measures, and then so that we don't have to go into another set of lockdown that has been so devastating in many settings.
Right. And staying with our COVID-19 related measures, Dr. Your efforts to contain the third wave have been going on for about 4 months now. And compared to the first and second waves, we appear to be having a difficult time to bring it under control. What is hampering our efforts, in your opinion?
Well, my ideas only for the Korea, not other country, because I cannot explain what's going on exactly now in Brazil, because Brazil is going up when they enter the winter season now. But Korea, I can explain it. From the beginning, in Daegu Gyeongbu province is very localized, and there are no other connections. But the Korean peninsula is quite small, but it's quite active. Our small country, we are all connected. After the break from the Itaewon Club break from the May last year, and end of the last year in the third wave started. But after that, every corner of the Korean peninsula, we got a COVID virus. The problem is middle age, like the 20 to 50, they are very young and healthy and asymptomatic persons, they are just passing with the COVID virus. We just can't tracing some of who has the symptoms. Still now, more than 20%, we don't know where it came from. So which means this kind of due balance and the due baseline in Korea around 200 and 300. The problem is 300 and 400 mean can be triggered to jump up 1,000 to 1.5 soon. So every corner we have the coronavirus, so we have to keep the wear the mask and keep the social distance. The problem is Now spring season is begun. So meltings, not only the freeze, the weather, our hearts also start to melt, and we forgot what happens last year. That time we should be take care about it, because 300, 400 mean any time can be a trigger to jump up double or triple soon. But now also we can see the other way. If we are give a little more attention, we can press down the number of COVID-19 sooner with the start of the vaccination.
Right. Professor Son, according to the Bloomberg vaccine tracker, 11 countries will reach herd immunity within this year, while other nations may take as long as 10 years. What problems do you see arising from this apparent gap?
Yeah, so I think, first of all, when we look at the Bloomberg, how it calculates this vaccination coverage and they're projecting how long it would take to cover 70, 80% of the population, I think it's important to consider it only looks at the vaccination rates or number of the actual vaccination coverage. So it doesn't factor anything such as natural immunity that's been obtained, effects of restriction measures or social distancing policies or efforts, and then other social and epidemiologically important factors in achieving overall herd effect to curb the transmission of disease. So they also acknowledge that this in their report. So we shouldn't take this for granted. However, what we should take note of this is that those countries that need to take 11 years or so to reach the ideal vaccination coverage. These are countries that are going to be most hard hit by the pandemic. At least right now in terms of numbers, but will eventually, and are going to suffer from this pandemic long after many of the countries are able to cope with this disease. And equally, these countries, we need to think about, these are in the resource-poor countries, such as Zambia, where they are having really difficult time obtaining and procuring testing equipment or kits. So for them, they're having difficult time testing people, and they don't have the capacity to treat them adequately and also monitor these disease. And in these settings, they are also experiencing double, triple burden of the disease that had been existing for a long time, HIV, tuberculosis, and malaria. So for these countries, and there have been reports and analysis that show that the COVID-19 and associated policy measures have left devastating effects in coping with these diseases, including the COVID. So these are going to be really big concerns of mine, as well as in the Global Health Committee, and really think need to be mindful of this. So like using COVAX and making sure that the vaccines are equitably distributed across globally is going to be a very important thing to do. Right.
Meanwhile, Dr. Yu, I believe you received the first dose of the COVID-19 vaccine recently. Are you experiencing any side effects?
Well, I got it, the AstraZeneca on last Saturday. From the beginning, I didn't feel anything because I'm among the work to see having my patients. So I didn't feel anything Saturday night. But the beginning of the Sunday morning, I feel my body is like a little bit heavy. So I can tell nothing particular and nothing serious, but it's not as same as like the seasonal flu vaccination. So feel a little heavy and a little hard. From the Monday, probably because of Monday, so still very kind of blue. But from the Tuesday, I'm fine now.
I see. That's good to know. Dr. Yu, I hear some people are taking painkillers like Tylenol as a preventative measure for possible side effects like fever or muscle pain. What are your thoughts on this?
So my suggestion is not only me and my colleagues, we have a certain very small number, but it's very, very important experience from the beginning. Highly suggested take the Tylenol or acetaminophen if you don't have the side effect or allergy. Better to take at the same time have a shot, and better to have a 1 day rest right after vaccination. So I heard that government has considered who going to have a vaccination for the young age because to give the attractive the chance to have vaccinated to more and more. Yes, I 100% agree. The school and the company and the workplace, please give or excuse 1 day right after the vaccination who going to the volunteer. This help to who the volunteer going to have a vaccination more.
I see. Meanwhile, Professor Son, I understand the timing of potential side effects after inoculation depends on the type of vaccine. Having said that, what can you tell us about the possible onset of post-inoculation reactions to AstraZeneca's and Pfizer's vaccines?
So in terms of the differences of timing, there's certainly, I think, that exists, but I don't think there's something that we can't really quantify or actually have clear evidence whether or not the rates of certain types of adverse events or timing is very different from one vaccine to another. But potentially, I think in terms of and what's more concerning is the more serious side effects such as anaphylaxis or allergic reactions. And for potentially mRNA vaccines such as Moderna or Pfizer, we may have some sort of an ingredient-based reasoning to why these vaccines may induce allergic reactions, and they may be due to polyethylene glycol or PEG. They are the lipid nanoparticles that are used for these vaccines to store the mRNA and also help the delivery of the mRNA into our cells. And these were widely used in other types of products and are known to induce these allergic reactions. So I think monitoring these potentially, but allergic reactions are more immediate responses, and the government has put in place, 15 to 30 minutes of wait time periods post injection to monitor these side effects.
Right.
So I think this, I don't consider the timing of the other kind of side effects to be a major concern, or at the same time, something that people need to be really worried about.
Right. And staying with vaccines, Dr. Yu, very briefly speaking, health authorities have granted the green light to AstraZeneca's vaccine for those aged 65 and above. Please remind us about the precautions before and after inoculation for the elderly.
Well, first of all, I welcome this notice. And I believe there are no problem to start vaccination from over than 65 years old. But we need a little more different strategies, more than 75 or more than 80, to be a little more caution. But I believe that more than 65 to 74 years old underlying disease person, better to have and start for the end of this month. There are no problem.
Right, I see. All right, Dr. Yu, as always, thank you very much for your thoughts. And Professor Son over in Daegu, thank you for being with us today.
Thanks, Sunny.
Right, indeed, the pandemic is far from over, so do seek to abide by prevention measures and to get your shot of the vaccine when your turn comes around. Thank you for watching. See you tomorrow.